All right. Well, thank you so much. I do appreciate being here. I value the opportunity to talk to people. One-on-one in my office is very nice and intimate, but this way I can get to talk to many more people. But I also expect you to take this on and you to talk to people too. The whole idea from my perspective of community outreach is that we reach the community and the community reaches the extended community. And there's going to be times for you got to take note and say, yes, this is something that I can do. I can pass on to somebody else. So please, this is real important. This is hopefully something we can, like a pyramid scheme, I guess, but in a much better way than the pyramid schemes we know about. One of the questions I get asked a lot is, how or what gives me the right to talk to a smoker, because have I ever smoked? Disclosure, I've never smoked. I tried, I really wanted to, but I was an athlete, it didn't make me feel good, and so no, I've never been a smoker. I hope in the audience there are no smokers, but I imagine some of you have been smokers, and I also imagine that many of you know smokers. So there's something to learn, and there's something hopefully for you to pass on. So tobacco and smoking is a culture, and it's one that sometimes is difficult to fully understand, but to be able to convert a smoker to become a non-smoker, we do have to understand a little bit about what's gone on. And we'll talk about pre-1964, the U.S. Surgeon General's report, and post-1964. Beforehand, we all knew how cool it was to smoke and how sexy people looked, and that's essentially how tobacco and cigarettes were sold. You were cool and you were sexy and you were the height of fashion. You were, the main person at the party if you were smoking, so everyone liked to smoke. The tobacco industry has not really been honest and continues to be dishonest. It supports the government. It gives them billions of dollars every year, and I say to myself, why does this industry still exist when the government could close it down in a heartbeat? Well, the government wants it to exist because the government gets a lot of money from it. So we're sort of caught up in that mix of government and industry supporting each other, and we're the innocent victims. Because I don't want anyone to think that I as a physician, and by the way, I'm a certified tobacco cessation specialist as well as the other things that I do, but none of the physicians or clinicians that you meet will look at you and judge you and say, well, this is your decision, you chose to smoke and we blame you. No, we don't blame you at all. No one blames the smoker. This is the industry and this is government. That's who I blame. The tobacco industry managed to breed the tobacco plant that made it much more potent. The potency comes from nicotine. The more nicotine there is, the more nicotine you get, the higher the addictive quality or nature of that tobacco product. So the scientists at Philip Morris and the other Reynolds, etc., they knew what they were doing, and they bred these tobacco plants to make you much more likely to become addicted. They also changed the nature and developed the science of the delivery device, the cigarette. They made it so that it was much more able to get you the biggest hit and quickly of nicotine. The industry is scientifically corrupt. We know that. We have heard that they have hid a lot of scientific data. They knew very well that tobacco and smoking was unhealthy for us, but yet the industry was supported. Somebody had to make money, and if it was at your expense, so be it. So yes, we know it was cool and we were encouraged to smoke, and we also know that it made us feel okay. And if any of you were in the armed services, part of your rations probably included cartons of cigarettes. Why? Because it made you feel calm. If you weren't in the armed services as well, but you went through stressful times in your life, what calmed you better than a cigarette? Of course, nicotine calms the centers in the brain. We'll talk about brain chemistry in a little bit. So the tobacco industry has evolved. It's not just a cigarette that you buy in a pack. You can get loose cigarettes at various different stores, little cigars, or they're called cigarellos, big cigars, you know what those look like. Now that Cuba is going to be doing business, I'm sure we're going to see a lot more Cuban cigars rolling in. Roll your own hookahs. If any of you have seen what the young kids are doing recently or lately, they're all going to the hookah bars. They love it. They don't think it's tobacco. Smokeless. This is something else we need to understand, and different parts of the country have different styles and cultures of using tobacco, and not so much here, but in other parts of the country, and certainly in the South, they're using a lot of smokeless tobacco, and this is very popular amongst the younger folks, but also becoming more popular in places like New York City bars and clubs. Why? Because it's smoke less, and there's no law governing smoke less tobacco. But chew, snuff, snooze toothpicks, dissolvable. Like, you've ever seen those little Listerine breath pads that you put on your tongue and they dissolve? They got tobacco like that now too. It's amazing. E-cigarettes. We'll talk a little bit about e-cigarettes. I do not agree that people should be using e-cigarettes, and that's another discussion. But this is where the tobacco industry is evolving to. Why? Because people are becoming wise to tobacco, and there have been some declines in tobacco use, which is great. So the e-cigarette industry has developed about 10, 15 years ago. Little mom and pop chemist shops in China moved over to the United States, and of course big tobacco bought up the e-cigarette industry and is now pushing the e-cigarettes in a very similar way to how it marketed cigarettes way back when. We'll talk about that in a second. But there's no regulation. The FDA has not regulated e-cigarettes. It's not considered a tobacco product at this time, but it's owned by big tobacco, and there's good evidence that suggests that e-cigarettes are a gateway for our kids to other tobacco products. This is when you, as grandparents and uncles and aunts and friends of people next door who have kids, you have to speak up. You've got to remind them that e-cigarettes are dangerous pathways to smoking or to tobacco. There's a whole online culture too. It's one that is not easy to get into, but once you're into it, oh, it's sexy and cool, and they've got things that they give you, and they invite you to parties, and you're part of the club if you're in the online tobacco culture. It's alien to me, and I hope it's alien to you too. Marketing and coupons, yes. A lot of money gets fed back to consumers through coupons. Why? Because taxes are so darn high. What is a pack of cigarette here now? Over $10, $12? I don't know. Hopefully, again, none of you are buying these days. But it's very expensive. So how does the tobacco industry get over that? They give you a lot of money in terms of coupons to get reimbursement, so it doesn't cost you so much. So how was tobacco marketed? Different flavors. The e-cigarette industry is doing a remarkable job now. Raspberry crush, caramel flavors, chocolate, all different kinds of flavors now that are encouraging. Who are they encouraging? The kids, and believe it or not, the women as well. So women and kids are marketed to, as they were back when tobacco was being heavily marketed. But menthol was one of the biggest corruptors of cigarettes. Why? Because it made it took the acidity or the harshness out of inhaling on a cigarette and made it much more minty and cool. And people thought that smoking menthol cigarettes was safer for you because it didn't have that harsh feeling as it went down your throat into your lungs. But actually what it did, it made people inhale much deeper. So their level of carbon monoxide and their level of toxins was far higher than people who smoked the harsh cigarettes and the unfiltered ones. So menthol was a disaster for people, but it was a well-hidden way of packaging by the tobacco industry. Suggestive words like light, and light, different spellings, slims. My God, if I could smoke something that made me feel slim, how wonderful would that be? Or light, I like that. Joe Camel, Marlboro Man, he died of cancer, you know that. The Virginia Slims woman, how sexy was she? I mean, I still find her sexy, but she was a smoker. So marketing was to women and children. Oh, Ronald Reagan, yes. You remember Ronald Reagan. He was on the front of many tobacco adverts with packages, cartons of cigarettes in front of him, cigarettes hanging out of his mouth. This last line is quite shocking. $10 billion a year spent by the tobacco industry. That's $27 million a day. $27 million. It's unfathomable. And as I said, most of it is spent on the coupons to offset the taxes. So the tobacco industry is really, really powerful. Nicotine, great chemical. It's one of the most addictive chemicals there is. When you compare it to like heroin and morphine, probably more addictive. The reason is from puff to brain, 7 seconds, very rapid. And the half-life, you see a little bit further down, is quite short. So when you take your cigarette and you smoke and you inhale the whole thing, you've got a great dose of nicotine, but not so long afterwards, the dose of nicotine starts to go down. And that's when you start to develop these withdrawal symptoms, which are not pleasant. Who wants to feel anxious or irritable? Who wants to have difficulty thinking and concentrating and focusing? Who wants those cravings? Who wants to feel hungry? No, I want to be the Virginia Slims woman, and I want to be calm and cool like Ronald Reagan, so I'm going to smoke. And that's why tobacco and cigarettes are so masterfully created to keep us or make us and keep us addicted. The dopamine, that's the brain chemical. You've heard, I'm sure, of dopamine. It is that very basic chemical that is part of our pleasure center. Food, water, sex, and nurturing. Who needs anything else? If I had all those things, I'd be so happy. Well, all I need to do is smoke a cigarette, and I've accomplished all in just one puff. It takes a long time to overcome the withdrawal effects, at least 4 weeks. So if you're going to stop smoking, you're going to be suffering. You're going to be wanting all that food, water, sex, and nurturing, or a cigarette, for 4 weeks until those feelings go away. I am trying to get this across, and it is, in a sense, my style is entertaining or humorous, but it is so serious as well. And you know it, you feel it, and I do too. We all do. So in 1964, the Surgeon General said smoking causes cancer, amongst other things. Cardiovascular disease, your risk of heart attack, stroke, and peripheral arterial disease goes up. Your risk for emphysema, chronic bronchitis, that's COPD, goes up. And it's not just lung cancer, but it's cancer of almost every single organ in the body that skyrockets. So tobacco and smoking is bad news for the body. If you continue to smoke, there's a 50% chance you'll die prematurely from cardiovascular disease, respiratory disease, or cancer. Well proven. 500,000 people die every year because they smoke, and they're murderers as well. Because if you smoke around people, 50,000 of those people will die every year as well. So we need to realize the social responsibility of smoking. It's not good for us. It's not good for the people around us. It's not good for the kids that we carry on our shoulder. You've heard of first-hand smoke when you smoke, second-hand when the room is full of smoke. Third-hand smoke is when the tobacco particles are on. You've been into cabs that smell like tobacco. It's because the particles are all over the seats, over the walls, over the carpeting. And that's the third-hand smoke. You wear clothing that has tobacco particles on it, and if you put your baby over your shoulder, you're getting that baby exposure to nicotine, tobacco, and all those products. 1964, the Surgeon General told us tobacco caused cancer. And yet in 2015, over 20% of adults continue to smoke. Men, we've always known this, men are more, I'm not going to say stupid, but men are weaker than women and they smoke more. The poor versus the wealthy, the lower versus the higher education, the southern states versus the north, east, and west states. There's a certain demographic. The tobacco industry knows right where to go, and they know how to exploit these people as well. And one thing that I didn't put down here is those people with mental illness. And that mental illness can be anywhere from anxiety and depression to things like schizophrenia and mania. But these people have a very, very high rate of tobacco use. Oh, we really should talk about lung disease and lung cancer and cardiovascular disease related to smoking as a disease of childhood, because that's when it starts. And if any of you were smokers, you'll remember that you started smoking, you took your first puff, your first cigarettes before you were in your 20s. There's no doubt about it. 4,000 children start smoking every day. 90% of adult smokers had their first cigarette before the age of 18. We have been doing a good job. It's true. Smoking rates are coming down. But what are they doing? Where are they turning to? E-cigarettes. It's a revolving door. They may be going down on the tobacco right now, but they're getting into the e-cigs. They'll be right back to the tobacco. The hookahs as well. Again, the kids, no one really realizes that these fruity flavored tobaccos, it's tobacco. It's just as dangerous. Just because it's filtered through water doesn't take out all the toxins and chemicals. So how do we prevent people from, or what's the first step in tobacco cessation? Prevention. And it would be wonderful if I could get my hands on everybody and stop them from smoking. But many times it's secondary prevention, because people who were smokers and quit, they relapse, and we have to do the secondary prevention. But what do we need to do? We need to educate people. We need to talk to families. We need to go to schools. We need to talk to coaches. We need to get out there into the public. This is what you need to do. You need to get out there and talk to people. You need to talk to your kids. Trust me, they know about e-cigarettes, and they know about cigarettes, your grandkids do. Talk to them about it. Bring the conversation up. As a parent of a 16-year-old and a 10-year-old, when I bring this up, I get screamed at. But when my in-laws or my parents talk to my kids about smoking, they listen. So you can have a tremendous influence. We need to promote healthy lifestyles. A lot of people, when they get into this tobacco world and smoking world, they lose track of healthy lifestyles like good nutrition and exercise. Many of my patients will tell me that they don't think that it's safe to exercise while they smoke. I don't exercise because I smoke, because it's not safe to exercise. Quite the opposite. It's safe to exercise, and if you exercise, the likelihood is your chances of smoking, or should I say the chance of quitting, go up. You're much more likely to quit if you follow a heart healthy lifestyle. We need to lobby the government at a local, state, and federal level, and it works. You look what Bloomberg did, and I'm not being too political here, but Bloomberg made a big difference by introducing a lot of tobacco-free areas, the bars and the clubs and the restaurants. I love to go into restaurants in New York City now. No smoke. I go in London, it's a disaster. I can't stand it. I walk out. You can walk in the park now and not be assaulted by tobacco and cigarette smoke. Bloomberg did this. Well, I'll pat him on the back for that. It really made a difference. Raising taxes makes a difference too. The higher we put, the more tax money we put on the cigarettes, the harder it is for people to afford them, especially the young people who aren't as savvy in terms of buying from out of state or Canada or using the coupons that the tobacco industry will supply. So let's make these things real expensive. So how do we understand if someone's a smoker and how do we evaluate them? Well, the 5 A's. We have to ask, we have to identify someone. We have to advise, well, that comes in one word, quit. We have to assess, so we have to know if they're really ready to quit or not. And we have to help them quit. We have to assist them. And then we have to make plans for the future because it's not always easy and people have their ups and downs, and we have to arrange for follow-up so we can keep our hands and ears and eyes on our patients. So how do we identify someone? Or maybe they'll identify themselves, but if you go to a healthcare practitioner and they haven't asked you if you're a smoker, well, they're not really doing their job. We should all be asking at every opportunity whether people are smoking. A lot of people don't think that they're smokers. Oh, I only smoke 1 or 2 a day. I only take a puff of my friend's cigarette. I'm sorry, that makes you a smoker. There's no such thing as a safe puff, let alone a safe cigarette. I only smoke at parties. We see a lot of these social smokers and these binge smokers, a lot in women. They'll go out, they'll have a couple of drinks, they'll smoke half a pack of cigarettes, and you ask them, are you a smoker? Nope. How do we evaluate? Well, there are many different tools to evaluate people for their smoking addiction. The Fagerstrom test is one that's probably the most sensitive. Look at some of these questions. How soon after waking do you smoke your first cigarette? You know, there are people who will not get out of bed before they've smoked a cigarette, and I'm sure some of you may have experienced that. Do you find it difficult to refrain from smoking in places where it is forbidden? So it might be illegal now to smoke in a restaurant, but you're having such a hard time, you're either going to light up or you're going to walk out. Which cigarette would you hate to give up most? Well, that's really looking for that first cigarette of the morning. And how many do you smoke daily? Do you smoke more frequently during the waking hours or the first hours than during the rest of the day? And do you smoke even if you are so ill in bed for most of the day? I mean, yeah, as a non-smoker and never been able to be a smoker, it blows my mind that this is a question that we have to ask people. But it's true, there are some people who are so rotten, but yet they're feeling so rotten, but yet they're still going to smoke. So how do we help people quit? We have to work out what the best quit plan is for them, and we're going to go through some of that. We need to understand what the home environment is like. Well, it's hard to quit if your walls are yellow and your curtains stink of smoke and your carpets have never been cleaned and there's ashtrays all over the place and there's people smoking in other rooms. So we need to understand the environment. What are your triggers for smoking? You know, that great James Bond scene of a cigarette after he's treated the Russian female spy to some entertainment. There are triggers. People have triggers. People have a cup of coffee and they'll smoke. People will walk down a certain place and they'll smoke. A certain memorial will come up. It might be the loss of a loved one, and that's what will be the trigger for smoking. We have to identify what those triggers are, because then we need to make a difference. We need to try to steer people away from those triggers. What are your social patterns? Well, I get up in the morning, I have a cup of coffee, I go down to the street and I walk 2 blocks before I get on the bus. Oh my God, yeah, I've smoked 2 cigarettes, one with a coffee and one with a walk. What are the patterns? And they're very often subconscious patterns that we have to dig in and identify and understand. What's your social network like? Well, if everyone around you is smoking, it's real tough. If your parents are smoking, then you're going to smoke too. If your friends are smoking, then you're going to smoke too. It's hard to get rid of your parents in that way or change social circles, but you have to maybe employ people around you. Nothing makes us feel better than being able to help someone, and I encourage my patients who are smoking and they're preparing to quit to go to their friends and family and say, I am going to be a non-smoker as of such and such a day. I want you to help me. And they'll be so happy to help you. What does life look like after quitting? How are we going to prepare for the wobbles in our life which come along? We need to talk about all of these things. We need to set a quit date. People have used Martin Luther King Day. They've used July the 4th. They've used anniversaries and birthdays. Very special days. These, it could be any day. It's whatever's meaningful to you, but set a quit date. And when you work in a comprehensive tobacco cessation program, you'll be encouraged and helped to set a quit date. How do we manage the ambivalence? We know it's bad for us, but yet, oh, it feels so good. So this is what happens. If you just quit cold turkey, the likelihood of you staying long-term quit is about 4%. If you do it with a buddy, it's about 8%. If I say to you, stop smoking, we leave it at that, it's about 8%. Not very effective. Quit lines. There are quit lines all over the place. 1-800-QUIT now. That's the state quit line. Whatever state you're in, you can call it. 13%. Counseling, either individual or as a group, 20%. Not bad. Medications alone, 22%. Medications and counseling, that's the best, 28%. But you see, we're not at 50%. We're not at 100%. This is really, really hard. And again, we have to work really hard with our patients that they don't beat themselves up. This is not your fault. But yet the sense of guilt, the sense of, I failed is very real, and we have to work with people on that. Financial incentives. People have been offered $200, $600, $1,000. It works. The literature, well, there's not many people who are prepared to give out $1,000, but so the literature is a bit slim on those, but there are other methods. So let's talk about how do we support people when they're trying to quit smoking. It's not just about preparing and understanding and going through this sort of counseling and evaluation process. People smoke because they're addicted to nicotine, and people smoke because of the habit. The habit can be broken through the counseling and the advising, but the nicotine needs to be replaced. When you stop smoking, as I told you, within 2 hours, you're craving for a cigarette. You have experienced it. So using nicotine as a replacement is okay. Nicotine is not dangerous for you, and you can be on nicotine for life. Hard to imagine. I'd much rather keep someone on nicotine replacement for life, which could be 20 years or 30 years or 50 years, than have them smoke. It's much better to be on nicotine. It is a drug, yes, it has some side effects, yes, but it is safe compared to the 7,000 toxins and carcinogens that are in a cigarette. We have different strength patches depending on how much you're smoking, 21 for the 1 plus a pack day, 14 milligrams for between a half a pack and 1 pack, and 7 for those who are sort of coming below half a pack. As well as the patch, there are other ways of getting your nicotine: gum, lozenge, an oral inhaler, and a nasal inhaler. The gum and the lozenge, these are not used like typical gums and lozenges. The lozenge is parked in the side of your mouth. The gum is cracked once, 2 cracks, put it in the side by your cheek, and that's where it stays. Because nicotine will make you nauseous. If you chew, or suck on the lozenge and you swallow the saliva, you're going to get very nauseous. A lot of people say, I can't tolerate the lozenge or the gum. Why? I'm nauseous. What were you doing? Chewing. You've got to use it correctly. The nasal inhaler, believe it or not, is the one that most represents the passage of nicotine from puff to brain. Remember I said it takes 7 seconds? The nasal inhaler has a very rapid absorption rate and stimulates the brain receptors very quickly, so it's very helpful. The oral inhaler is shaped like a cigarette, and many times people will like that because it gives them something to hold. The people who've held a cigarette, they like to hold things. So this can be very helpful. And the other thing about the inhalers and the gums and the patches, gums and the lozenges is it's something that's very active that you can be doing, as opposed to just the patch, which you put on in the morning, and then your fingers have to you have to sit on your hands. When you have something else to do and you're more involved in the tobacco cessation, then that's helpful. Now, you can combine patches with other methods of nicotine replacement. Don't forget, every cigarette has about 2 milligrams of nicotine. So if you smoke 20 cigarettes, what's that, 40 milligrams? If you're putting on a 21 patch, it's only half the nicotine replacement that you need. So you need to combine that with a gum or a lozenge or an inhaler to get the nicotine you need through the day. So the patch goes on first thing in the morning. Hopefully it's preventing the cravings, but if you get a craving, if you start thinking, if a trigger comes along, take some hits on the inhaler. Crack a piece of gum, put it in the side of your mouth, and you'll get the nicotine that will hopefully take away that craving. Other drugs that work, centrally acting drugs, there are 2 on the market, bupropion or Wellbutrin or Zyban. You'll have seen it advertised. This enhances the dopamine effect, that pleasure center. Side effects, insomnia, and we can't give it to people who've had seizures because it can cause them. And we can use this in combination with people who are using nicotine replacement. The dosing is down there, that's under the guidance of your physician. People can stay on Wellbutrin or bupropion for 3 to 6 months or even longer if we can keep them off the cigarettes. Varenicline, the Chantix, you've also seen advertised. This blocks the nicotine receptor, or the nicotine binding to the dopamine receptor, should I say. And so this is not used with nicotine replacement because nicotine replacement wouldn't work because the receptor is blocked. So this is used on its own. A lot of people swear by it. I have not seen the best success with it because it doesn't allow patients to be active in terms of their smoking cessation. They take a pill and that's it. No, people like to put on the patch and use the inhaler or use some gum as well. A black box warning for depression and suicidality. I think we're going to find that is actually probably not a major issue, but it's still out there right now. You can start both Wellbutrin and Chantix about a week before you plan to quit, which sort of starts to help the quit process. What about other methods as well? And if it works for you, it's great from my perspective. None of this is scientifically in peer-reviewed journals supported, but yet if it works, that's great. Hypnosis, acupuncture, laser on the acupuncture points, these are tried methods and can be very helpful. And at the Perlmutter Cancer Center, there's a wonderful integrative health program which does a lot of these techniques, these integrative techniques, and they've been very, very successful. E-cigarettes are being used and touted as tobacco cessation products. They are not approved. While they may be safer than using cigarettes, they may come with their own dangers that we don't know about yet. They're still poorly studied, and they're certainly not approved by the FDA. Do not let your kids use or your grandkids use e-cigarettes. They're not approved. What do people get concerned about? They're very worried about gaining weight. It's better to be 25 pounds heavier than it is to smoke a pack of cigarettes a day. Don't worry about the weight gain. The weight gain is actually, or the cravings, or the hunger is actually helped by nicotine replacement therapy and Wellbutrin. And what about relapse? It happens a lot. I'm sure if you've been through your journey, you knew, or you know it took you many times to quit. There's very few people who can quit cold turkey and stay off the cigarettes. So we need to prepare for that. The benefits of quitting within minutes: lower the blood pressure, lower the carbon monoxide, improved stamina within a few days, improved sense of smell and taste, not that tobacco in your mouth, lower the risk of myocardial infarction. Within 3 months, the lung function is improved. This is interesting because a lot of times people say, I quit smoking, I'm coughing much more now, I'm sicker than I ever was before. No, the tobacco, the nicotine, paralyzes the hair cells in the lungs, and so all that mucus that you're producing sits down there. When you stop smoking and those cilia, those hair cells, can start to waft up the mucus that we all produce, you start to cough up that junk. That's a good thing. You're not getting sicker, you're getting healthier. Cardiovascular diseases, 2 to 3 months, improved circulation, a year, 50% reduction in MI risk. 5 to 15 years, your risk of an MI or stroke is equal to the general population. But look at that, 10 years, only 50% reduction in risk for lung cancer. So best never to start, or if you've started, quit as quick as you can. A couple of numbers or websites, smokefree.gov, 1-800-QUIT now. These are all great sites and numbers to call. The NYU tobacco cessation number, 1-855-NYU-QUIT. We have a diverse tobacco cessation program here, the Perlmutter Tobacco Cessation Program, 212-731-4542, and we also have at the Cardiac Rehab Center as well a tobacco cessation number. Thank you so much for listening, and I am proud of you for not smoking.